Alan Maryon-Davis is an honorary professor of public health at King's College. He joins us now live from Salisbury in the UK. Thanks so much for speaking to us. I first need to get your take on this small steps towards really easing restrictions, allowing the construction industry, for example, to get back to work in Spain, and the desperation of trying to improve the economy. As a doctor yourself, do you think it's wise, or are these premature steps that should be more carefully considered?
Well, I'm sure they're being carefully considered. The difficulty is striking the right balance and knowing how to gradually ease the restrictions. And in some cases, it might be done on a geographical basis. In other countries, it might be done on an age group basis, children, young people. Sometimes it's done on a sort of industrial sector basis, like construction industry or other industries, building manufacturing industries. It varies from place to place. Whichever approach you take, it's got to be done in a very carefully managed, measured way, very step by step, because you must accompany it, as the WHO have said, it must be accompanied by very thorough testing, so that because the countries can get an idea of whether or not the disease is coming back, is resurging, because that's what's got to be balanced against the gradual easing of restrictions in a very careful and calibrated way.
Right, and that's what really is frightening, is we just don't know if there will be a resurgence. We've had some preliminary studies showing that perhaps people aren't building up the antibodies and the antigens to show that they have a sort of immunity if they've already been infected and suffered the worst of this illness. Tell us where you think it all stands on really understanding how dangerous this virus is and how much longer it might be with us and remain as threatening as it is now.
We really do not know. I mean, this is the dreadful thing about this virus, apart from the fact that we do know it's a killer and it's extremely dangerous. We don't actually know how it behaves in populations, because it's so new and it hasn't been with us that long. So we have to look to places like China, for instance, and Wuhan in particular in China, where it began, just to see how it's playing out. Now, of course, they've relaxed a lot of restrictions in Wuhan, and there's a lot of traveling around now and a lot of mixing, although people are still trying to maintain some social distance. But we need to see what the virus does in those situations. And ditto when we look at Spain, with the relaxation of the gradual relaxation in Spain, the whole world will be watching very closely to see how the virus behaves in that situation, and whether there's any sign of its coming back. As you say, we don't know whether people do develop a meaningful immunity to this virus over a period of months or even beyond.
Is it taking longer than you expected, actually, to be able to understand this virus? I mean, when we look at something like SARS, its arguable predecessor, in hindsight now, I mean, getting SARS under control seems like a cakewalk, even though there was a lot of panic over that virus. It was relatively quickly managed and brought under control. It's been months now with coronavirus, and we're still at this point of really no idea how this virus behaves. Are you surprised?
Yes and no. I mean, in a way, we learned a lot about the virus quite quickly from China, because the Chinese scientists very quickly did the genotyping on this and shared that with the rest of the world. And so we had a kind of a head start, really, on understanding the virus. I mean, those countries that experienced SARS and the later similar virus called MERS, countries like China and South Korea, they were very quick to lock down very firmly. And that's paid off in many ways. So you look at the figures of the epidemic in South Korea, it's kept at pretty low levels because of that very firm lockdown from an early stage, and a lot of testing as well. So it's interesting that countries can learn from these previous epidemics.
Right.
We are learning quite fast, but not fast enough, unfortunately.
Yeah, just very quickly, as you probably know, we're seeing some of the wet markets where it's believed this virus originated. That's the best theory so far. We're seeing them now reopen in China. Does that scare you as a public health official?
It does, and I think the WHO has got an important part to play here, as indeed do the to governments concerned, such as the Chinese government, in paying attention to what can be changed in the way of behaviours and practice in some of these markets, and be quite firm about it too, in controlling the way the mixing of animals and humans and the contact that comes between them in a situation like a market. And there will be other situations as well, like farming, agriculture, where there are close connections. And we need to be much firmer and stronger about how those situations are managed in future, with much stronger laws, tougher laws, according to the WHO guidance, which will emerge from this when we all learn the lessons, when we look back on this in a few months or even a year or two's time. Those lessons are going to be so crucial in preventing another one of these awful pandemics.
Dr. Maryon-Davis, thank you so much for joining us there. We appreciate it.